And now introducing our nurses, Mr. Andrew, Miss Bethany, Miss Lauren, Miss Carolyn, and Miss Angie.
All right, folks, welcome to today's show. We have a very special episode in store for you. We are focusing on patient teaching today with a musical twist. And first of all, we're going to take a quick commercial break, and we'll be right back with you.
I'm here to see Dr. Rome. He needs to hurry.
Okay, come with me, Miss Yolanda.
Okay. You need to slow down, little skinny missy.
Alright, have a seat up here.
Lady, I am 300 pounds. How do you want me to sit up on a thing like this?
Alright, that looks good. Okay, so nurse practitioner Rome will be in here shortly.
Okay. My whole life I have been such a skinny girl.
Hey, Miss Sanchez.
Hey there, how you doing?
Hello, everybody.
How you feeling today?
How do I look like I feel to you, lady? I am 300 pounds. I can barely breathe. My blood pressure is so high. It makes me feel so sick to myself. Good luck trying to get the BP with this.
What's your diet then? Like,
I just eat whatever I want. Do I look like I'm on diet to you? I can't help it. My husband, he just left me for another one.
240 or 100?
That's pretty good for me, actually.
Okay, that sounds pretty high, Miss Sanchez. I'm going to start you on a potassium-sparing diuretic called aldactone. And I want you to take 50 milligrams twice a day. And when you take your pill, I want you to take it with a full glass of water, okay? And that should help you eliminate or decrease your edema, okay? And help you with your blood pressure and heart.
We might want to think about changing your diet up a little bit. Watch out for how much bananas you're eating, your potatoes. Cut the french fries out, okay? Let's try some exercise too, maybe walking 2 or 3 times a week to start off with for about 15 minutes. Low pressure, no running though.
Lady, I'm not running. Do I look like I'm a runner to you?
Does all this sound okay to you?
Yes, if it saved my life. I guess I'll be one to do it for Dr. Rome.
Well, don't hesitate to call if you need anything, okay?
So I won't, Dr. Rome.
All right.
Thank you, sir.
Miss Sanchez, looking good. You here to see Dr. Rome again?
I sure am, little Missy, let's go. Aldactone saved my life. What can Aldactone do for you?
All right, and welcome back to the show. Like I said, we have a very special show in store for you today, and it's musical teaching about our cardiac drugs.
You know, I find myself I have so much trouble with teaching and I don't know how to get it through to patients. It's just hard finding a good way to do that.
Sometimes they're just not, they don't respond well to just talking. So I feel like this is going to be a really good way to reach all kinds of cultures.
Absolutely.
Because it goes over their heads, and even as we forget things that we need to remember, oh yeah, this drug, I'm going to point that out. So this is just a quick tip to help you with that.
Yeah, really catchy way.
So what are some of the main ones for y'all that y'all have problems with? Any suggestions?
Well, I'll start off because I have a big trouble with the osmotic diuretics.
Yeah.
So, you know, you just forget like, oh, can I use this with glaucoma or not? Which this one you can. So that's something we need to remember as nurses. And the big thing is to heat the bile before you use it, because we don't want to get those patients with crystals. Yeah. Shake it up, heat it up. You know, we have to do that. Make sure that there's none in there before we give it to them. So I called a former boyfriend of mine.
Oh.
Yeah, you know. Flow right out. I called him and I said, would you please help me out with this drug video? Like, I really just need you. And he did a great job.
I'm surprised.
You know,
I do it, but I
I'm
mean,
sure he dropped some mad beats on this.
He really did.
Let's check it out.
For your entertainment. Yeah!
lemon sauce. Lemon sauce. Get it right. Lemon sauce. Lemon sauce. Shorty got that osmotic diuretics, ankles with the pub, her whole heart thumping with the blood. She
she hit the flow. Got coming on more. Electrolytes go low, 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 low. Got the crystals in a vial and you need to shake it up. Shake it up. Don't want none of that crystal urea. She hit the flow. Got coming on more. Electrolytes go low, 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 low.
Alright, welcome back. I hope you enjoyed
Yeah.
Florida's video.
Good.
I thought he did a great
He
job.
was great.
Yeah. So do we have any other drugs that people also have trouble with?
You know, I have to say thiazide is probably my worst.
Yeah.
It's also a diuretic, which I find are probably the hardest. I always forget to tell people to stand up slowly.
Yes.
You know, what
Yeah.
they call orthostatic
I
hypotension.
mean, how many times has that happened in
We
patients?
can't be missing that one.
Yeah.
Yeah.
And then they fall, and
Yeah.
you know, and also I always forget to tell them they need to eat more potassium. You know, add some potatoes into your diet, bananas. It just slips my mind. You know, especially when they just get all loud and they have no idea what I'm talking about.
Explaining other foods that have
Yeah.
potassium is hard to remember.
Because most of them don't know potatoes have potassium.
Right.
I didn't
Yeah.
until
A
nursing
lot of people
school.
don't even like bananas, and so there's other options,
Right.
and that's what we're here to point out to them.
Yep.
So who'd you get?
Well, I called a girl from high school, Kesha Reddick.
Oh,
Yeah. So anyway, I called her, and she flew in from Japan, and so take it away, girl.
Wake up in the morning feeling weak and dizzy. These diuretics I be taking making me all crazy. Before I sleep, I make sure they're not fat. Cause if I swallow in the night, my blood be coming back. I'm talking thiazide in my mouth. Beam potassium out. BP is going down. Chloride acting on my artery could cause lithium toxicity. Gonna get all ethnicities. Don't stop till it drops. BP causing all this fuss tonight. I'm a peach, salty as a red sea. Kidney stone in the bowl. High calcium, don't you know?
Hello there. I'm Andrew Rome with Procter Gamble, Solomon & Rome Associates, attorneys at law. Have you taken Lasix in the last 6 months? Did you experience any severe side effects, such as severe dehydration or severe spells of hypotension? And did you fall during those spills? Most important of all, did your nurse teach you about these untoward side effects? If they didn't, I can win you a lot of money and a huge settlement. Just ask Miss Miller, how much money did I win you?
$1.2 million! Now I can stay home and play Nintendo!
Welcome back, folks. I hope y'all enjoyed Kesha Reddick because
Yeah,
she did a great job.
Thank goodness she came back from Japan for that one.
I
She's so hot right now.
Oh,
Okay.
I love her.
I know for me particularly, one of the biggest drugs I have a problem with is the beta blockers.
Yeah,
There
there
are.
are a big group.
So many of them, I cannot remember which one, and the doctor prescribes, and I'm like, wait a second, what are the side effects of this one? Also, sexual dysfunction is the biggest side effect.
Hot
of these.
topic.
And you get awkward talking
Don't
about
want
it.
none of that.
Yeah, nobody wants to talk about it, and like you gotta think if we're awkward talking about it, how are we supposed to expect our patients to know?
To let us
Just
know.
gotta
Yeah.
come out about it.
Throw it
You
out
just
there.
gotta talk about it.
And you never know when the patient's not on their, like why they're not sticking to the regimen. You're kind of
Right,
like, oh, there's
why,
something
why?
wrong.
Right.
And we forget that this is something we need to ask
Yes,
about.
absolutely. And I was able to, our producers actually were able to get in touch with an old lady, Lady Blocks a lot.
Yes.
She's funky,
Old
but,
school.
My dad used to jam to her.
absolutely. Lady Blocks a lot.
Right.
Oh my gosh, Bethany, look at her heart. It is so big. She must be taking a lot of drugs. Like, she must be one of those pharmacist's girlfriends. Yeah, like, oh my gosh. What a total...
I give beta blockers and I cannot lie. You other nurses can't deny. When a patient walks in with some big heart pain and some screaming in your face, you give drugs. Wanna put on that cuff, that pressure better not be rough. Decreasing the rate and beating. O2 need is depleting. Oh, patient, I wanna sit with ya until you get the picture. But listen to my warning. Stand up slow in the morning. Low pressure in that tenement cause sexual dysfunction. But use them, cause your heart rate will be cruising. I see you aching, so you better be taking Indorol, Sectral, beta blockers all in Ebola. I'm tired of magazines, say nitrates is the thing. Take an average patient and ask him that. Beta blockers stop heart attacks. So patient, patient,
Yeah.
the blocker gonna work. So take that blocker drug. Beta is back.
So good. I'm so glad environment for that. Like she doesn't even record anymore.
She's still a babe too.
She's
Yeah.
not even in a wheelchair at that age.
She can move it too. She was moving.
Whoa,
it.
can she not? Anyways, yeah, I mean, on top of everything, like nobody even knows what calcium channel blockers are.
No.
When they think anti-anginals, they think of the big ones, like nitrates or beta blockers. You know, they don't ever really even think about the calcium and what the calcium does in your body. It speeds up your heart, makes you need more oxygen, and what the calcium channel blocker does is blocks that calcium. You don't need as much oxygen. And the clients just don't really understand that.
You're about to pass out just telling us that. I can imagine you in there with the patient.
Yeah.
It is a mouthful.
Yeah, and it's just like up here, we got in, and so what I was able to do is I got in touch from somebody from Maroon 5. Yeah, I got in touch with Angela Levine.
Wow.
Yeah.
So bad.
Yeah, so she was able to come up with us, and I sat down with her and told her my struggles with it. And she was really able to hit home with the subject, and I think that if we showed this videos to her clients, they would completely understand.
For sure.
Yeah.
Anyway,
Give it up for Angela!
Oh my God, like what's wrong with me? I've been in here all day, like I don't even know what calcium channel blockers are. What is that? WebMD won't tell me anything. Who are you? You're my nurse?
I'm your nurse.
You and I got chest pain, certain dysrhythmias or hypertension. You and I need something for this problem, maybe a medication. You and I heard of calcium channel blockers, but what is that? You and I know something for your heart, but let's get deeper than that. Nurse, there you go again, saying those words. Cal and Procardia, Cardizem, and calcium channel blockers. Got it stuck in my mind, what do they do? Tell me, I'll listen to you. So it helps my heart so that I won't wanna die. It decreases the oxygen, you can take it at night. Less oxygen is needed so your heart can rest. Relaxed arteries will help the pain
welcome
and
back from that amazing hit from Angela Levine.
Yeah.
One of the things that I pose a problem with my patients is the medication nitroglycerin, which is a nitrate. They complain about their headaches, the dizziness, you know, they want to get up too fast, get their grocery shopping done, and end up hitting the floor before they get out the door. So we gotta slow them down. So I got my buddy, Andrew Ray Jepson.
Oh, what?
He is so hot.
Such a babe.
How did you get him?
Well, he's my buddy, we're golf buddies. I was sitting over the way.
Yeah.
So, anyway, he's got a hit song for us called Call Me Maybe, and here it is.
Oh, I got this terrible headache.
I'm so sorry to hear that. We're going to fix you right up, okay, sweetie? All right. Headache, you're not feeling well. Got you in a dizzy spell. Got up too quick and you fell. Emergency room all day. You trade your patch for a pill. You ask the doc to refill. Too many things that you missed. Chest pain is in your way. Weak heart, barely holding the air. Veins are showing. Hot flash, steam is blowing. Where you think you're going, lady? Hey, I wanna help you. I'm a guy nurse lady. I've got some teaching. So listen, maybe it's hard to find the right medication. I've got some teaching. So listen, maybe. Hey, I wanna help you. I'm a guy nurse lady. I've got some teaching. So listen, maybe it's hard to find the right medication. I've got some teaching. So listen, maybe.
All right, welcome back. We just want to thank everybody for tuning in and watching the show. We hope you got a lot out of it. For all the nurses out there, share this on YouTube for your clients.
Get it out there.
Yeah, we're
Get
gonna
this
post
out
it.
there.
Because you all are going to be patients at some point. I hope you learned a little bit
Yeah.
from our segment today.
To all the artists out there, we want to say a huge thank you for
Thank
hanging on
you.
with us, y'all.
Thank
Yeah,
Yeah.
thank you so much.
Tune in next week, same time, we'll be here. Have a good
All right,
night.
thanks.
Now and then I think of when you were so healthy. You could run 1,000,000 miles and never die.
But nursing school brought a stress on you. and winter turned to spring so soon. There's a pain in your chest you will remember.
But you didn't have to smoke so much. Heavy meals and beer really have clogged your arteries. Because you didn't need those drugs, but the breakup left you lonely and you've had enough. No, you didn't have to drink so much. You partied all night and you're puking all over the toilet. I guess you only ate Big Macs. So now you're just somebody with a heart attack. Somebody. Now you're just somebody with a heart attack. Somebody. Now you're just somebody with a heart attack.
Wait, sorry. I wasn't counting.
In the morning, baby,